So we need oxygen to live, but did you know that we need oxygen to actually heal? Today, I'm going to be talking about hyperbaric oxygen therapy and how we can actually use this to energize our bodies.
You're watching the Dr. Jake podcast.
I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician in Salt Lake City, Utah. On this channel, I share with you how you can heal your body without any harmful drugs and surgery and get your energy back. Be sure to subscribe for more videos like this one. So the big thing is we are an aerobic organism, meaning that we need oxygen for every cell to be able to survive and live. Different than, for example, like a cancer cell that doesn't need absolutely oxygen to be able to live, but our cells do. So what happens is we need it for the electron transport chain inside our mitochondria. And when I say that, all cells have mitochondria except for our red blood cells. And if we don't have oxygen, guess what? We're not going to make energy, which means every tiny little cell in our body is not going to be able to have the energy it needs to be able to function. So our heart's not going to be able to pump, our muscles aren't going to be able to work, our brain's not going to be able to send its signals appropriately. So we need oxygen for that last step. We go through a cascade of energy production in the mitochondria to actually make ATP production, and we need that oxygen to be able to get that going. We can increase our oxygen by making sure that we are actually taking good breaths. Doesn't necessarily mean that you're getting oxygen into your brain or your heart or getting a good amount of oxygen into there. So many times you could feel really tired or brain foggy, or a lot of your body functions aren't working very well. It's because you're not getting good oxygen delivery in there. And that's why I like hyperbaric oxygen therapy, because a lot of people have this inflammatory response happening in their body, decreasing the red blood cells being able to give the oxygen into the tissues. And hyperbarics gets that oxygen right into the fluid of our blood. So we talk about deep breathing. Okay, you breathe in, you get the oxygen inside your lungs, and then it gets into our alveoli. And then our red blood cells go and dock there for a little bit, get that oxygen onto them, and then they get dispersed out their body when the heart pumps. That then is going to have to get to our tissues like our brain, our heart, muscles, etc., through capillaries. Capillaries are microscopic like a red blood cell is. So the red blood cells have to collapse to be able to get into there. So let's say you have some type of inflammatory response that's happening. So a lot of us do not, even if you don't have an autoimmune condition or whatever, the capillaries get inflamed, they narrow. So not as many red blood cells are able to go in and out. So you're not getting as good of oxygen delivery. So when we do hyperbaric oxygen, we don't care about the red blood cells anymore. One cool thing is they did an experiment on mice, and they took out all the red blood cells on them, and they had them in these little hyperbaric chambers, and they're able to live just fine without the red blood cells because the oxygen gets right into the plasma of our blood. The plasma then doesn't matter how narrow that capillary is because it's just in the fluid base, and it's able to get into there and deliver that oxygen into our tissues. And that's what's so great about hyperbaric oxygen. It's able to elevate that oxygen delivery into our tissues and stimulate that regenerative process through stimulating that mitochondrial function and getting that energy working appropriately. One big thing it does is it decreases that inflammatory response. So yes, you do hyperbarics, you heal your body up, you're going to be able to breathe normally and get that oxygen into your tissues. But one thing I want to say here, you could be the healthiest person on the planet, like athletes that play tennis or football or whatever. They're supreme athletes. They get a great effect from doing hyperbaric oxygen therapy too, because when you do intense exercise, you're going to cause inflammation. You're not going to be able to heal as well. So when we do hyperbarics, we're able to get that oxygen in there, and you're be able to regenerate and heal better. Also, when we increase the oxygen delivery, we're able to function better and be able to perform the activity in a better fashion. So just because you are a very healthy person, you're still going to get great benefit from hyperbaric oxygen therapy. So what's happening is it's putting your body under pressure, and through that process, it's shoving that oxygen through your body. So when you're in a hyperbaric chamber, most of the time nowadays, you're going to have the surrounding air, and also you're going to have an oxygen mask, which is pure oxygen. But all that air, that 21% of oxygen that's in the air, is going to be getting into our system, right through our skin, right, going right into our blood through that, because of the pressure that is placed on our body is how that's working. One big thing it's going to do is it's going to, like I said, it's going to deliver the oxygen into our bodies more effectively than any other way. So just increasing oxygen into our tissues, like into our muscles and our brain and our heart, all these tissues are going to work more efficiently because we're getting more oxygen in there than we would by just normally breathing. And that's going to deliver that oxygen to our mitochondria and get ATP production made. Also, what's cool about it is it increases the efficiency of your mitochondria to be able to make the oxygen. So you're getting more oxygen, but then it's able to use it more effectively. So you're able to get greater energy production through that. We talked about earlier that it causes this decreased inflammatory response. So what's the big deal? If it decreases the inflammatory response, how is that going to increase my energy production? How it does that is inflammation will bog down all your metabolic pathways. And when I say that, it's going to bog down how your mitochondria work. So it's going to decrease that inflammation, decrease that bogging down of our mitochondrial function. Also, inflammation will decrease the effectiveness of all our organs throughout our body. So let's talk about the thyroid. It will affect that. Our adrenal glands. It will affect how our gut absorbs nutrients, on and on and on. So if you decrease the inflammation, all your energy mechanisms of action are going to work better. You're going to make better thyroid production, cortisol production, absorb your nutrients better, make more testosterone effectively, balance out your estrogen progesterone ratios. All this is going to happen better because of that decreased inflammatory response. Also, it's going to work better because all these organs are going to be getting extra oxygen delivery to them, so they're going to work more effectively. Hyperbaric oxygen also has a great effect on balancing out our blood sugars. A lot of research on this, helping with type 2 diabetics or pre-diabetics. It helps decrease the amount of blood sugar inside our blood. Some theories behind it is it's increasing the sensitivity of our cells to insulin and able to bring the sugar out of our bloodstream into our cells more effectively. Also, we're seeing that just the blood sugars don't spike as much when people are doing hyperbaric oxygen therapy. So it's a really cool response that can happen there too. Hyperbaric oxygen will increase how your cells work better, but you're still going to be able to sleep just fine. Now, I have had some patients that just juices up their cells so well, and they just want to get things done, and their brains are on fire and working so well, and they can't do that. But majority of people are able to go in the chamber and right afterwards fall asleep. 99% of people. Most people, I recommend about 20 treatments, and you're doing this about 2 times a week. That's average. Now, if we dive into the research on hyperbaric oxygen therapy when we're treating certain chronic conditions, they're doing about 40 treatments. But I'm usually not doing hyperbaric oxygen therapy all by itself. So I am usually doing 20 treatments with these patients with all these chronic issues, but I'm doing all kinds of supplemental advice, dietary advice, and usually many IV procedures. So we don't have to do as many hyperbaric oxygen if you're just doing all by yourself. But if you're just doing hyperbaric oxygen therapy, you're going to be doing 20 or 40 treatments to get the greatest effect for you. The big confusion comes from marketing. I see this all the time. Many people say, oh, we're going to do an oxygen treatment to treat this. And many times they're talking about ozone because a lot of people don't know what ozone is. And they're like, oh, what? We're using the ozone layer or whatever. And they get confused and people just use the oxygen term. But ozone and oxygen are completely different. So to describe it, oxygen is O2, ozone is O3. You might be like, oh, it's just one extra oxygen molecule. How is that really different? We could talk about, okay, we have oxygen, then we have 2 hydrogen atoms. Okay, that makes water. That's completely different than oxygen. So we could think of it that way too. So when it's in the O3 form, it's a completely different molecule, and it makes it into a very antimicrobial substance is what we're finding. It's very good on killing off all bugs throughout your body, bacteria, viruses, fungus, etc. So it's great with that. It also decreases inflammatory responses in a different way than hyperbaric oxygen therapy does. It also increases these LPS type of things that are released from your organs that increase your general health. But it's a completely different substance. Now, when it goes into the body, it's O3, does its work, then it gets broken down to O2, which is regular oxygen, and does the oxygen effect too when you do that. So you do get a double whammy. You get the ozone effect, then it breaks down to oxygen, and you're getting that oxygen effect throughout your body also in a different way than hyperbarics does, though, because you're not getting that pressurized environment, getting into your tissues more effectively. If you want to learn more about hyperbaric oxygen therapies or other therapies like this, click my video to the right. I'm Dr. Jake, and I'll see you there.